Good afternoon, RGEA members and guests. Welcome to today's webinar entitled MyChart and Other Patient Portals, Managing Your Health Online, presented by RJ Reyes. He is the co-founder and CEO of Growing Older Digitally. For short, it stands for GOLD. He will unpack some of the mysteries of the health portal and the importance of knowing how to use them. I am Daryl Davis Fulmer, and I'm honored to serve as your host for today's Lunch and Learn. I would also like to extend my sincere thanks to Cindy Christian and Tracy Eubanks for their technical support, and to thank Jackson Kozort from RGEA Government Relations for joining us today. We greatly appreciate your membership as well at RGEA. So before we get started, I want to give a plug for the upcoming conference on September 21st in New Bern, North Carolina. It's up on your screen now. So please register if you're interested as soon as possible because space is limited. It doesn't matter if you live in that district or not. You are welcome to join us if you would like to come. You can go on our website, go to the calendar and register there, and also watch for your emails on this conference. So now we will hear from Jackson, who will give you a brief association update.
All right. Thank you so much, Daryl. And once again, I want to reiterate, thank you so much to our members. We are a membership-based organization. We cannot do this without you. So thank you so much to all of our members. But I'm going to dive right in. I have a whole lot of stuff to cover in a very brief amount of time. Most importantly, after 1,000 days, North Carolina finally has a budget. We ended the 2025 calendar year. We were the only state in the entire country to not pass a state budget, and it's my honor to share the good news that the state retirees did receive a 2.5% one-time bonus in the final budget. It's about $140 million appropriation. Now, RGEA, we will always be striving for that true COLA. But just the facts are, with the amount of retirees that we have now, we have over 250,000 retirees. A true COLA, just a 1%, has ballooned to over $600 million. So we were happy with the 2.5%, but we'll always be working towards that COLA. But to keep in mind, the local COLAs and bonuses for local retirees have nothing to do with the state budget. That only has to do with investment returns, which comes from the state treasurer. And that's why in 2025, we were also honored to team up with the state treasurer and his office to pass House Bill 506, which is the State Investment Authority Act, because over the last 10 years, North Carolina has been ranked either 49th or 50th, and actually over the last 15 years in investment returns. And that is why Elgers, the local retirees, have seen basically nothing in bonuses or COLAs. But I'm very happy to report that in just the first year after that bill being passed, at the end of the calendar year, Treasurer Briner ended the year with a positive 13% investment return. So if the investment returns keep going like they're going, we have a light at the end of the tunnel, and we are fingers crossed for 2027. We are going to get a bonus or COLA for both the teasers and the Elgers. But if you have any questions, I'll try to drop my personal email in the chat, or you can email Daryl. And as always, check out News from Jones Street. It's an article we put out every single Friday, or you can go to rgea.info, click on News from Jones Street, and you can read everything that I've written over the last year or so. But that's my time. Daryl, back to you.
Jackson, you finished so quickly. That was great. Thank you. And before we get started as well, I see that Tim O'Connell has joined us. He is our executive director, and I'd like to thank him for being here today and also for all the work that happens at RGEA. So before we begin the webinar, have a few items to cover. You are in listen only mode for today, and the only way you can ask a question is through the Q&A button at the bottom of the Zoom page. So please use that button if you would like to ask us a question, and we will try to answer all that we can during the Q&A period or before. And for those of you who sent questions with your registration, we submitted those to RJ already, and he has told me he has incorporated most of them into his presentation. This presentation will be recorded, and we will send you the link to the recording along with the PowerPoint and I believe a handout in our follow-up email. Now to share just a little bit about our speaker today, RJ Reyes, who is again the co-founder and executive director of Growing Older Living Digitally Inc., a North Carolina nonprofit that helps adults 50 and older build confidence with everyday technology. Since launching in March of 2025, Gold has served more than 9,000 older adults through workshops on digital health, scam prevention, and AI literacy in communities across North Carolina and beyond. I learned about RJ in one of my statewide meetings, and I'm anxious to hear what you have to say today, RJ. So thank you for being with us. Welcome and take it away.
Awesome. Well, thank you so much for that intro, and thank you so much to everyone at the RGEA for having me today. It's a pleasure to help the communities across our state and across state lines. So today, what we're going to be talking about, like Daryl said, we're going to talk about MyChart and other patient portals and how we can utilize those to manage our health online. Before I kind of get into it, I want to have us start thinking a little bit about our health portals and how we navigate our own digital health management. So, just a couple questions as we kind of go through today. To think about for yourself. Do we have a patient portal? Do we know what it's called? Have we ever logged into it? And if you fall into, a place where you aren't confident about that, that is one of the biggest things that we strive to do for our communities at Gold is to help you build the confidence to not only navigate digital health and the changing technology and digital world, but to feel confident in yourself, to learn and succeed and continue life doing all the things that you've already accomplished. A little bit of technology is, it can be a change, but we know people are, able to move past that, hurdle or barrier. And we want to help you build the confidence to do that. So as we get into it, we have a quick poll here, or two quick poll questions to get us started. Looking at our screen, have you ever signed into a patient portal? Some people use it regularly. Some people have only used it a handful of times. Some other people might have never used it, and some people aren't sure. So let's take a couple seconds, answer the poll question, and we'll see just about where everyone's landing. Awesome. So thank you so much for the results. Looks like a good amount of people have used their patient portal and use it regularly. Um, as things go and what we've seen in our communities, that is an amazing thing. Some people have only used it a handful of times, and some people might not have ever used it. So I believe everyone's going to walk away today feeling more confident, having learned something that they can then apply. Now, if we look at our second poll question, and this is one that we often address in many different communities, what is some of the biggest barriers to using our health portals, or what makes it hard to use? Because at the end of the day, if we can start addressing some of these, barriers or hurdles, and help people get past that to then manage their health, that is something that we strive to do, and we want to, help as many people do as we can. So we'll take a couple seconds and answer this poll question here. Awesome. So looking at the results, a lot of people have it work just fine. Some people, have run into the problem where they, think about its security and safety, or they might not be able to find it, or they just don't have a resource that's ever shown them, the ways, they can use it and why it's so important. And like I said, today I think we're going to cover a good amount of people's questions. We're going to go through all of these things so that you feel confident at the end of the day managing your health online. And to speak on technology, this is something that's changed for everyone, no matter the age. When we think about health records and managing our health online, with technology, everything's moving to a digital source. And like I said, people of all ages have been, navigating this through the years. And some people navigate it with very little help. And we want to be that resource for anyone we can. So if it's felt confusing, that's a reasonable place to be. And even for myself, learning how to navigate my own digital health management, has come with its own myriad of challenges. So nobody's alone in this. And, we want you to leave knowing why it's worth it to start looking and seeing, how we can do that for our own lives. So quick, what we're going to cover today, we're going to help everyone with the resource to find their portal. We've given a handout that will be sent out after the webinar today that's going to have some information for you on and help you find your portal. We're going to talk about how our information is kept safe. We're going to talk about what our portals actually do and why it's a benefit. And then we'll make sense of, things that are out there. We're going to answer some questions at the end. If you have any questions, like Daryl said, please put it in the Q&A button down at the bottom of your webinar page, and we'll hopefully get to answering some of them at the end. So a quick overview on what a patient portal is. Most of us have used it, but for anyone who hasn't, this is a really good review. Our patient portals give us a way to access our health records on the side of managing them and communicating with our healthcare providers and our healthcare teams so that we can be proactive about managing our health as we, live and age. So a couple of the main things, and we're going to see a lot of this through all of our different health portals that we talk about. Some of the main features are going to be the ability to see test results, message your care team with certain questions, requesting refills for prescriptions and medication, managing our appointments, making appointments, canceling appointments, all those things, and then viewing and sharing our records. So because we're helping so many people across the state and across the country, there are several different health portals. And when I say health or patient portals, one that comes to mind for a lot of people is MyChart. And MyChart is probably one of the most used EHR or electronic health record systems in our country. There are several others, so we're going to talk about some of those. But for the most part, all of them have nearly the same features or very similar features to allow you to manage your health digitally. And like I said, just to name a few, we have Meditech, we have Oracle. MyChart is a very well-known one. They all have the same purpose. It's a little bit different software with different names, but they all help us manage our health online. So real quick, 2 ways to find your health portal. And this will be covered in our sheet afterwards. But to get started, there are 2 really easy ways that you can go about finding, if you have a patient portal, how to locate it and get logged in. So starting out with MyChart, if we go to mychart.org/login sign up, this is going to be where I recommend people to start, because a lot of times if you go to a health system, there's a good likelihood that it is part of the Epic or MyChart system. So if we go to their website and we pick our state and we search up our health system by name, it will give us the direct login or website to go to get ourselves signed up and logged in. And if for some reason you don't see yours on MyChart's page, or if they're not part of the MyChart system, there's more than there's a good percentage chance that your system does have a patient portal. It just might be through a different company or a different system, and you can find that by going to your own health system's website. Look for patient portals or medical records. Some patient portals run on names like Oracle Health, Meditech, Athena Health. So depending on where your system is or what your system's called, starting at their website is also a very good spot to be. Real quick, before we start diving into our patient portals, one quick nuance is, when we see patient portals or health portals, we often get asked, is my insurance portal the same thing or does it do the same things? And the answer is not quite. A lot of our insurance portals, which have also moved online, like MyHumana, Aetna, eBenefits, Caremark, just to name a few, those are all separate. So those are through your insurance. And they also give you the ability to manage your insurance on that side, but they are different from our patient portals. Some things you might be able to do there is look at your claims and coverages, your ID card, what drugs might cost, and certain things like that. Our patient portals are going to allow us to, log into our healthcare system to communicate with doctors or hospitals, view test results, visit notes, view your medication lists and manage that, as well as send messages to our care team. Now, if you get your care through the VA, My Healthy Vet, which is now at va.gov/myhealth, that is going to be where you can go to sign into your side of the patient portal. And the older My Healthy Vet username and passwords might not work anymore. They've had a change in their system, which now redirects you to a login.gov or an id.me. So if you've had a recent sign-in attempt, if you get your care through the VA and it didn't work for some reason, that change is what's going on behind the scenes there. A couple things to think about with patient portals, and oftentimes we get asked this question, are they safe? And what do our health systems do to help keep our information safe? Talking about our usernames and passwords, when we log into anything online, you often see Face ID or two-step verification. A lot of these things are put in place now to help add levels of security to anything you might log in so that your passwords and your information is protected. And now the same thing applies to our health portals, which often have a two-step verification that includes either a emailed or text message code, fingerprint or face ID on your phone, which in most case scenarios is faster than remembering and trying to type in all your usernames and passwords. So those systems are in place to help us keep our information safe and navigate it easily. And then on the healthcare system side, they have a legal duty to protect our information. When we think about anything regarding our own health or doctors, hospitals, HIPAA guidelines often, dictate what they can and can't do as far as safety and how they should protect patient information. So they have a very big proponent to protect that. Obviously, it's very personal information at the end of the day. So all of those things will be in place to make sure your information is kept secure and safe. Now we talk about the usernames and passwords, which is one of the most common frustrations with portals and anything really technology. And it's a very fair, frustration. We ask so many times, we're asked to log in, create a username and password. And sometimes there are so many places people often get confused or lost, which is all right. And myself included. There are probably so many things that I have usernames and passwords to that I don't remember off the top of my head and I don't have written down. But now our technology serves a purpose to help us with that. So the password keepers that are built in to our devices often store and fill them in for you, and they recognize what you're trying to log into, and it'll auto-populate your username and password for you. And now, obviously, writing them down is perfectly fine, and we often recommend people to do that, but to keep it very safe in a secure location, so that just in case you lose your phone or anything happens on the technology side, because it isn't perfect all the time, you do have a way to manage and keep track of those. And then one thing with MyChart, Uh, we now have the ability for anyone who uses MyChart to have a single sign-in that can cover your login through several different systems. A big example of this is we'll talk about the Triangle region of North Carolina. You have WakeMed, Duke, UNC. Those are some of our biggest health systems in North Carolina. And if you go to several different ones, which oftentimes people do, they now have one sign-in that covers all of those through your systems. So you just have to log into one and it'll get you access to all of the ones that you're in, as long as they are all part of the MyChart system. And like I said before, the security systems that are in place, they want to verify you. So they'll ask for your identification, whether that's your name, address, date of birth, email, fingerprint, face scan, text to code, email to code. All of that goes to prove your identity, which now oftentimes is a little bit more than just a name and a birth date. And then if you are separate, or if your system is separate, login.gov account does not sign you into your hospital portal in some case scenarios. And the portal credentials may not work on government sites. So there is that distinction as well. One other thing about safety, we often talk about scams and keeping our information safe in the digital world. And we've seen in the last couple of years an uptick in scam attempts, especially around healthcare, health management. So, talking about how we receive messages from our health systems, knowing this pattern can oftentimes help us recognize when imitation is happening. So when we get a message from a healthcare system, whether it's email or a text message, it will ask us or say that something is waiting, or let's say our results are are in from a recent test result. It'll tell us that, but it won't ask us to click a link to sign in. It won't tell us to call a certain number. It is just notifying you that something has been uploaded in your portal for you to go and check. It will never ask for identifying numbers like your social security or your Medicare number or password. So if you see an attempt or a message that says something along those lines, just take that with a 60-second pause to assess whether or not it is something that we should take a second look at, because they oftentimes happen and people may see that and think, oh, I need to click this link or answer this question to get my results, or whatever that message might be. So if we take a couple seconds and think about what it is, that oftentimes can help save us from potentially having our information at risk. Now, something that we've been teaching at Gold for the last year and a half through all the work we've done is our SCAM method. And this is a 4-step process to help people recognize and stay safe from scam attempts. And to go through it real quick, it is a quick and easy to remember acronym. All you have to do is remember SCAM. It stands for stop, confirm, avoid giving out personal information, and make a report. Now, stopping, like I said, 60 seconds, pause before you act. A lot of times we act without having that thought of, is this safe? So if we pause and then can confirm through a trusted source, whether that's a direct phone number that we can find on our health system's website or anything's website, or a direct phone number, we can verify that information there. Avoid sharing personal information like passwords, social security numbers, those type of things. And then if you do think that you have been part of a scam attempt, it is always helpful and beneficial to make a report either to the FBI, the FTC, to the health portal or health systems, contact us, just so more people can be notified that these attempts are happening. Because if we report it, it can potentially help so many other people see that these are happening and then stay safe on that end. All right, so we're going to start diving into the importance of what these patient portals give us. So like I said, we have 5 or so things that typically most patient portals will do for us and how they allow us to manage our health. And we're going to talk a little bit about why it's important to know these things and to get comfortable with some of these. A lot of our examples here come from the MyChart system, which is a very common system. It may not look the same for every single person, and it may not look the same if you're using a different system, but most of what's here is going to translate in some way, shape, or form to another system. So as we open up our portal, here we have an example of a MyChart portal. You're going to have big, nice tiles right along the top. And these buttons often give us access to our most common tasks, like seeing our recent visits, scheduling appointments, viewing test results, seeing any messages that have come in that we need to check out. It'll also have sections where we can access our own profile and our personal information and settings. Looking at how we view our test results, and this is something that has changed tremendously over the years. If you went to the doctor or were in the hospital and you had test results done, you would often have to wait until you got a call from your doctor or system to give you that results. Now, these results get posted right into our patient portals in a relatively quick manner. As soon as they're finalized, they oftentimes get uploaded and you'll receive a message that you have test results waiting. And you can also see visit notes and summaries from your doctor or healthcare team regarding those visits. And a really interesting thing that has added to this layer is now we can see trends over time. So if managing your health over the last several years has been a task that you've been doing, you might have noticed that now we can see historical results in our test results and tracking it over time to see how things move through the years. So here's a quick example of a blood panel example that's been done. And they've done a really good job in most of our health portals to show us visual representations as opposed to just the medical jargon that surrounds a test result. So here we have a bunch of different things that have been measured in this blood panel, and it gives us a really good bar graph of where our numbers lie. Like I said, this is an example, but you can see everything here is in the green, so that test result comes back and looks good. Now, one caveat, a lot of times the test results do get uploaded before your doctor or care team has had a chance to review them. And if so, and you see them, it will say that you are viewing these results and your healthcare team has not had the opportunity to view them. In that case, oftentimes what happens is you'll receive another message that says, your doctor has reviewed your test results and now you can go in and view those. Another important factor of these patient portals is the ability to message our care team. Oftentimes we are left with questions either before or after a visit or instance where we go to our doctor. And now this gives us a way to directly contact them regarding our medical questions. And it's a lot faster than playing phone tag with our systems now, as many people say in our workshops and places we help. They'll call and they can never get to the right person, or it takes a long time. This has now given us a good way for us to ask our care team about our medications, follow-ups, results, updates, all of those things so that we can stay in tune with our health. And obviously, one big caveat with that is for any emergencies, this is not where we need to go. Obviously, dialing 911 is going to be our main route if it is a medical emergency. The messaging, our care team side of our patient portals, is for those questions or things that we want to, stay in communication with them about outside of our in-person visits. Requesting refills. A lot of times we are managing medications and it can get a little confusing dealing with our pharmacies and the doctors and refilling prescriptions. So now inside of our health portals, you might have the option to request refills or see information regarding our medication so that we can stay in touch with where we're at in that process. And along the way, it also gives our doctors and healthcare teams a way to make sure that we're staying in check with what we have and addressing any issues or things that they can help you manage on their side, as well as reviewing information like your dosage and directions, which will all automatically be updated from your care team when they put that in your portal. Appointments and getting seen sooner. When we schedule appointments, we oftentimes think of calling our doctors or healthcare system to make appointments, but now we have the flexibility to manage that on our patient portals. And this gives us a good opportunity to be proactive about scheduling our appointments or doing e-visits and doing check-in procedures before we go to our doctor. The e-check-in process now replaces the clipboard that you get when you walk into the waiting room and have you fill out all your information. You can now do that online through your patient portal a few days to a week in advance of your appointment, just to ease the process and efficiency of your visit, as well as looking to see if you need to book an appointment with your doctor. You can now see their schedules in most cases online, so you can pick dates and times that work best for you. Talking a little bit about video visits and your health records. A lot of times people live farther away from their healthcare system than they'd like. And taking the time out of our day to go and visit the doctor in a short-term scenario is can be quite a headache. And with video visits, some of our patient portals allow us to join a uh, private, secure visit with our doctor over a tool like Zoom or their internal tools, where you can then talk to your doctor and conversate, ask questions, manage your health from afar, which has added a layer of convenience for not only you, the patient, but for our healthcare system to help more people manage their health. A couple things with the records, documents, and such. We do have places in our health portals where we can manage that, where we can request records, share documents with other doctors or healthcare systems if you go to several different ones. That way you can help manage that process. We think of how faxing used to be a thing where you would have your information faxed to a new doctor. Now you have the ability to access all of your records from your patient portal. And one thing that I quickly pointed out before, but we're going to take a look at here, most common features throughout all of our healthcare systems patient portals are going to be very similar. They might not be exactly the same from one health system to another. And like I said, if you have several different healthcare systems that run on or use MyChart, that has added a layer of convenience so everything can be accessed from one point. But not every system is going to have every feature. Some might have all of them that we've kind of talked about today. Some might not. Some might have different ways that you navigate their internal system. But that's why it's super important for us to be proactive in learning these systems and patient portals so that we can become familiar with it, because it's only going to help us as time goes on managing our health. A couple other things, the apps or patient portals online, they might not have the same layout. So not every single one is going to look the same. And making sure you're familiar with it on desktop or your laptop or your device like your phone or iPad or tablet, whatever it might be, that's another big importance, so that when you're managing your health, you are pretty comfortable with where things are at. All right, we've got another poll here. And like I said before, a lot of times people have several different doctors or healthcare systems that they frequent. And just a quick question here, how many of us have more than one or several, in some cases, patient portals that we're managing at one time? All right. Looks like a good majority of the group has several that they manage at one time. Some have even more, which is, I'd say a great thing because at the end of the day, if we have several different healthcare or patient portals that we manage, that gives us even more access into that communication and ability to manage our health digitally. When we think about where technology was, let's say 15, 20 years ago, everything was nearly on paper. And if you went to several different healthcare systems, managing your records and your documents and all of those things regarding your health was a bit more of a strenuous process. But now with technology, it's given us the tools to do that a lot easier. And that brings us to the question of if you have portals littered all over the place. A common question and a fair one at that. We think about some examples like our primary care, our specialists, hospitals, eye clinics, some of our specialists on that side. Each one of them might have a different portal or secure login. So if we can become accustomed to getting ourselves logged in and knowing where each of one exists, that's only going to give us the benefit of ease as time goes on managing those systems. A quick look into MyChart. And through our work in our communities, we've worked a lot with Epic and MyChart, as that's one of the most prevailing patient portals or EHR companies or systems. They've done a really good job at linking your accounts so that if you visit several different healthcare systems, it'll be rather easy for you to manage and link those accounts so that all of your information is tied to your patient portal so that you can log in easier. You can manage across several different organizations easier and move between them without having all of those sign-ins and passwords and usernames kind of scattered about. And one thing in particular that's changed the game in the last year is anyone who's in MyChart system. They now have what's called MyChart Central, and that gives you the ability to create your Epic ID, which is your single sign-on for all of the MyChart healthcare systems that you might have, in your process of managing your health. They all will combine your records and give you the ability to switch and communicate with all your different MyChart systems from one spot. And this is super beneficial. We talk about all those logins and patient portals scattered about. Now we have the ability to manage from one spot versus trying to log into one system over here and then communicate to another system over here. It adds a lot of ease to that process. Now we talk about the MyChart and their capabilities. Sometimes connecting accounts doesn't happen. Speaking to some of our other healthcare systems or patient portal systems, they may or may not have the ability to combine them or make that ease of managing them from one spot. So what you can do instead is downloading your records and uploading them or giving them to different healthcare systems that you might, if they can't connect internally, so that that information can be, kept safe and, with each healthcare system that you go to, which is important to share for your doctors to have at your visits so that they get a good glimpse of your overall health, and can help you manage it from that spot. And nobody has to do this alone. When we first started doing what we do at Gold, a big barrier that we ran into was people who live in different places from their family or caregivers that might be helping them manage their health as they age. Whether you're the one helping someone or you're the caregiver, you have children, siblings, friends that help you manage your health, or both at the same time. What some of our healthcare systems and patient portals do now is allow the access to certain information for our caregivers, whether you're the caregiver or you have a caregiver, to help you or help them manage the healthcare system with a second set of eyes, as I like to say. Now, we get asked a lot of times, well, how come I can't just share my password with that person if I'm having my daughter help me with my healthcare management? The problem that comes to the forefront is the risk of exposure. When you share passwords and usernames for anything, that increases our risk of exposure. And, in, a worst case scenario that gets compromised, we don't want that to happen to anyone. And these systems also don't want that to happen. So, one thing to look for in each of your healthcare systems is the sharing hub, or where you can give friends and family access to your records. That has been a feature they've added so that if you have someone that you help manage their care, they can give you and invite you to have access to a certain amount of information within their health portal, whether that's managing their appointments or being able to communicate with their healthcare team for any particular reason. They have been very vigilant and proactive about having this feature so that more people can help their loved ones, their family manage the health in those situations without having to share passwords or risk the exposure of information. And that's something that you can do from the patient side. If you have somebody that you would like to have access to your certain information, you can go into your patient portal, and in that sharing hub or family and friends access, you can invite them to be a part of your healthcare management process. And it'll email or contact them so that they can fill out their required information and can get in to help you manage, or if you're the one helping manage, you'll get asked that information so that any type of privacy or protection doesn't become an obstacle, and it helps everyone's health be managed in the long run. Now with the VA, it works a little differently. They don't have a particular proxy, and all of their stuff goes through a release of information office. And like I said before, not every patient portal is going to act or be the same way. So finding that information on our handout where you can either call or communicate with your healthcare system to get that exact information is going to be your resource after today's webinar. A couple other common questions: changing doctors between healthcare systems. Sometimes our records will stay in our old portal for a certain amount of time, which you still have access to. You can get access, download, and copy them before moving. And if your patient portal can connect to each other, it'll be able to be shared internally. If you're traveling, a portal should work nearly everywhere. That way, if you're on a trip and you need to contact your primary care about a question or something regarding your health, you should still be able to contact them from wherever you're at, which is another huge benefit of patient portals. And if you haven't gotten a patient portal yet, there are a few different ways that you can sign up or get yours activated without an activation code from your doctor, or if you don't have a primary doctor yet. And some of those workflows are highlighted on our handout as well. You can go to some of those resources or your healthcare system's website to see how you can get enrolled or activated with your patient portal. And a couple of those ways highlighted briefly: you can ask your front desk staff during a visit how you can get activated. They might send you a code or a text or a code through text or email after you visit. They can print an after summary or an after visit summary, which will include the steps to get activated or signed in, as well as online resources from your healthcare system's website. A couple things to have handy is your email that they have on file, a phone in case they send you a verification code, date of birth, insurance card or medical record number. Those are some of the things that you would want to have on standby, just so that when you get through that process, you're not searching for all those things and having any barriers come up through that process. If you do get locked out, I have included most of our contact information or helplines for our healthcare systems throughout North Carolina and several beyond. So refer to that or to their website where you can find their direct phone number, and they oftentimes will have a specific one that you can, call based off your health system for this specific problem. Whether that's you forgot your username and password, or you've been logged out for several years and you need to get back in. They are the resource that you can call directly to have some help navigating that potential problem. So I know we covered a lot today, but one thing I highly recommend and what we do at Gold is we are very interactive, and we oftentimes have people try to complete one task so that we can start getting the practice of utilizing our health portals. So my goal for everyone this week is get logged in, find how you can get logged in, sign in and complete a task. That way you can start getting acquainted with your patient portal and how you can manage your health going forward. Now, a quick poll at the end to kind of wrap things up. After today, how do we feel? I know it's a lot of information and in such a short amount of time. I hope that everyone's learned a little bit of something that they can take away, but just a quick confidence poll. Take a couple seconds to see where everyone stands. All right, the results are in. Definitely seeing some improved confidence levels, which is amazing. And some people feeling about the same. Some people already feel good, which is amazing. Now, after today, like I said, try to complete a task, start getting acquainted with your system because they are super important in managing our health as time goes on. And if we all can do that, we can be proactive about our health and avoid any complications so that we can be all good. And thank you all again for having me on this webinar today. Thank you to the RGEA, Daryl, Jackson, the whole team. If anyone is interested in outside of this, our resources can be found on our website. You'll get our full NC portal reference in the email that'll go out. And if you have any other technology or want to check out our workshops where we help you with your confidence managing the digital world, feel free to email me at my email here. We are always open to helping people and questions at any time.
RJ, I want to thank you so much for giving us so much information today. We appreciate you joining us. So right now we have a few questions that have come in. Let me see if I can get to them and we can start maybe answering them. I'm
Yeah.
going backwards. Okay, here's one. If patient portals are safe, why have I received letters regarding my info has been breached? I don't know if you've dealt with that before. Doctors' offices claim their system is secure. I don't like them sharing my info with third parties, of course. And I see the staff at the doctor's office, not the third party staff. Can you answer that one?
Yes. So, in the grand scheme of technology, there is there's always a risk or potential that information gets exposed. And when we talk about health systems and patient portals, they do a lot of work to make sure our information stays safe on a local, state, national government level. There's a lot of guidelines, regulations, and rules that they have to follow. And sometimes information or messages like that say your information may have been exposed are simply and can be simply just that some type of information, whether it is as simple as your name or a date of birth, maybe not so much as our actual health information. If there was any risk at all, they are legally obligated to notify people who have had their information potentially at risk. Now, that doesn't mean that it has inherently been stolen, and that's something on the health system they do to be proactive. And when we think about technology, there always runs a risk of that, and that's why along the way we oftentimes talk about having safe passwords, having two-step verification, so that in that case scenario, your email gets compromised. Which I can say mine does all the time because of all the scam emails I get. My email might have been compromised, but because I have all of these things set up, like password protection, Face ID, that helps add those layers so that even though my email got compromised, my information is still safe.
That's a good, I never thought about it that way. I was thinking that everything would be compromised, but maybe not, depending on how you have it set up.
Right.
So this is a question Bob has asked. He said, let me see how I can do this. What will my PCP have to do to get a clear perspective of where I am and where I should go health-wise, especially since he's on two or maybe more charts, portals, I should say. And it seemed
Right.
like several people had more than one when we did the first poll.
Right.
Do the doctors actually look at the other charts?
Yes and no. I will say that, with our collaboration with Epic and MyChart, we've worked with them to, learn about these things from an internal perspective so that we can then help our communities learn. If your healthcare systems or portals connect through, let's say, a MyChart, oftentimes the doctors within that system can get access to your health information. Uh, a lot of times it requires a verification process. You might have to share it with them. But let's take the example of, somebody who lives in North Carolina and has lived in Wake County and went to Wake Med at some point, but now lives in a different part of the state and is with another healthcare provider or system. And they both use MyChart. Even though they're separated, there still is an ability for that information to be safely shared within the system so that your new doctor can still see your past healthcare management and information to provide you better care at your new location. Now, some of our systems that might not connect, that's where sharing your records might be something that you would have to intervene on. Or your doctor might say, because you're with us now or in the system, we don't have your prior 10 years of healthcare records. Is that something that you can get from your past servicer and bring over so that we can, have that information? Hopefully that answered the question.
Okay. All right. Yeah, because sometimes you have to pull it and then share it with your new provider. And other times it seems like they can find information. If it's in the same system and you talk to a different provider, then it's
Right.
all there. I think, it's still growing, but it is
Absolutely.
something that all of our members should be aware of and should use because they could have more access to their own health and understand it better. I'm trying to find, so someone said problems with portals, I think you may have answered this, are the limitations and structure of the options. So getting refills, changing appointments, getting appointments, visit summaries that don't
Mhm.
really say anything. Yeah, I see that sometimes. And getting to latest test results from varying providers might create an issue. Can you respond to that?
Yeah, and I'm trying to find that question as I'm looking at the Q&A as well.
It may be
Um,
at the top. It came in at 1241.
1241.
Mm-hmm.
Um, Problem with patient portals are the limitations and structure of the options. Yes, so depending on the system, its layout, its structure, it's going to be most likely different, and that can be a limitation. So getting refills, changing appointments, visit summaries, some healthcare systems use functions a little bit differently. So if you're in, let's say I go to WakeMed, so I always talk about that experience, right? I have access to messaging my care team about certain questions. But if I go to a different healthcare system, I might still be able to ask or message my care team about questions, but I have a different prompt or question I can ask, if that makes sense. Now, like I said, some systems utilize different functions based off of what they've had most of their patients either ask for or need. So it's going to vary a little bit system to system. And that's something that I highly recommend people to communicate with your doctors or your healthcare system when you're in the buildings so that they can give you the realest and truest capabilities that you'll have with their specific portal.
So here's just a comment, and then I think Cindy, we can capture these questions and send them back to RJ, and maybe we can get some answers out because we're running short on time at this point. But one person said, two of my different doctors' offices use the same patient portal provider. After much frustration with logging into these two patient portals, I finally figured out that I had to use the same password and user ID required email address for both offices. Looks like the problem was solved. And then
Right.
another issue that's come up, one person has asked, are UNC Wake Med Duke visit summaries, messages, etc., mixed together or sorted by provider?
It's a great question.
Yeah.
So now with at least speaking to MyChart and Epic, when you're logged in or you have your accounts linked through MyChart Central, which is our single sign on, so you get your Epic ID and that's your username, and you have one password to get you into Duke or WakeMed or UNC. No matter which one you're logged into, your most recent message is going to most likely show up first, or most recent notification. Now, it can separate them and sort them by provider. So if you log into your Duke portal from there, it's going to show you all of your Duke
Mhm.
messages and etc. Same with UNC and WakeMed. But it will show if you get a more recent message from one of your other providers, it might show you that so that you can still see it. And then you can access it from the same point. So it's mixed at this point, but it still gives you the ability to sort by provider or access it all from one point.
Okay. Thank you, RJ, again. That's it for our questions at this time. But audience, if you have other questions or comments, if you think of later, you can reach out to me at Daryl at rgea.info or to RJ, and his information will be in the handout as well as the PowerPoint and the information we send out to you today. So please don't forget, though, to complete the survey that we have at the end of all of our webinars and send that in no later than Monday. You should get it either by tomorrow or Friday. It's quick and easy, and we need your responses. They help us. A lot of folks that ask about MyChart and other portals, so that is the reason why we brought this one to you today. But before we leave, don't forget about the conference we're hosting on September 21st in New Bern. So you can sign up using our website, go to the events and then calendar, look for September 21st, and you can sign up there, or from an email you will receive from RGEA. I'd like to share with you the next webinars that are coming up next month, September 16th at 12:30, a webinar entitled Building Healthy Brain Habits, Taking Care of Your Cognitive Health is More Important Than Ever, presented by Lindsay Golden from the Alzheimer's Association. And this session will help you better understand dementia, it's a big issue, and how to protect your brain. And so please register by Sunday, September 13th for this webinar. We are also hosting an exclusive webinar on the following week, Wednesday, September 23rd, entitled Decisions, Knowing Your Medicare Options for 2027 as we prepare for open enrollment. This webinar will be presented by Jeannie Skepsey from the North Carolina Department of Insurance, the SHIP Division. Be sure to register for this one by September the 20th. Watch your emails for registration, or you can go directly for all of these events to our website calendar at rgea.info. All of this will be in the follow-up email, and then you'll get other information about these as they come closer to the date that they are offered. So thank you everyone for joining us. And as always, the association stands ready to assist you in your retirement. Happy Wednesday and enjoy your day.